Hello, viewers. You are welcome to another exciting episode of Youth Empowerment Series. Today, I have another special guest with us. As you know, I always bring special people to this program. So today, we have another special person joining us for this afternoon's discussion. My special guest for this afternoon's discussion is Dr. Robert AMESIYA. He is the current acting Greater Accra Regional Director of Health Services. He is an astute orthopedic and trauma surgeon who also holds master's degree in public health from the University of Ghana School of Public Health. Prior to his appointment, he was the medical director of the Upper West Regional Hospital. Under his visionary leadership, the Upper West Regional Hospital was recognized as the best secondary level hospital in Ghana for 2 consecutive years, in 2023 and 2024, during the Ghana Health Service Excellence Award ceremony. With over 2 decades of dedicated service in the Ghana Health Service, Dr. AMESIYA has demonstrated exceptional leadership and commitment to improving healthcare delivery in Ghana. Viewers, I would pause Dr. AMESIYA's profile here. We are going to pin the full profile at the description section of this video. I want you all to go there, read it, internalize it, and see how inspiring it is. This is just a little bit of it I've just given here. So we'll pin the full one at the description section. Let me also add that Dr. AMESIYA is my classmate in medical school. We are the SMS class of 2004 from the Kwame Nkrumah University of Science and Technology. So we've been out of school for the past 21 years practicing medicine. I'm so excited to have my mate join me here for this discussion because he's an inspiration. Doc, you are welcome. You are warmly welcome to this afternoon's discussion. You see how I'm excited to have you here. Very excited.
Yes, thank you, Dr. Sheila Dere. Thank you, Dr. Sheila Dere. And it's a great opportunity to appear on your very enviable show. I'm very grateful to be your guest.
Thank you, Doc. Thank you. So this forum is for youth empowerment and development. So we bring personalities like you who are making a lot of impact in your communities and impacting life positively. We bring personalities like you on this show so that you share your stories to inspire our young ones and the younger generation. And in sharing your stories, we are interested in both your success stories and also your challenges. This will help inspire the young ones for them to know that when they put their mind on anything, they can achieve it once they remain focused and committed. So that's why we have you this afternoon on this show. Doug, so we'll go ahead to set the ball rolling. Kindly tell us about yourself. We always want to know how our personalities grew up, how they were brought up. We want to know the schools you attended, from basic schools to your medical school to your specialty. We want to know how you made it. Maybe some people would think you were just thrown from the moon and you dropped, already made up. So I want to know whether you also passed through the normal stages.
Okay, so thank you, Dr. Sheila Dere. As you rightly introduced, my name is Dr. Robert AMESIYA. I'm a public health professional with a strong background in clinical practice and administration. I was born in a tiny village called Yorgo, about 5 kilometers away from Bolgatanga, the capital of Upper East Region.
Right.
I grew up in a polygamous family, a family of 26 children. Unfortunately, some of them are of late. And then I had my basic education in my home village. Then I proceeded to Navrongo Secondary School, where I had my secondary education. Actually, we were the last batch of the old system.
Okay.
In Ghana transition from O level to SHS.
Yes.
So we're the last batch of the old system.
Okay.
And some interesting things happened whilst I was in Vasco. Actually, you do general subjects from first year to third year. That was how the old system was structured.
Yes.
And then when you go to fourth year, you change and you either go through business, science, or arts. I had some strong conviction for business. So when I got to Form 4, I started doing business in the first term.
Okay.
But there was this teacher who taught us maths, who vouched that he would never allow me pursue business. So after one term in business, he brought me back to the science class.
Okay.
And that is how I pursued science. And then thereafter, another thing happened. You know, when in 1993, that was the last batch of the old system. That was the time prime time started this thing of brilliant science and maths quiz.
Yeah.
So this same teacher asked me to join that group, which I refused. And he told me if I don't join the group, he wouldn't allow me to write the final exams. So there again, I was forced to join the group of students that participated in the Brilliant Science and Maths Quiz, the first edition that Prime Time organized.
Okay.
And then Professor Adi was the one that moderated it.
Yeah.
And it used to be organized for Northern sector and Southern sector. So in the Northern sector, Navasco came second to Prempeh College. So when I came back, the teacher asked me that when I resisted, have I seen the performance we managed to do? Because we met quite a number of big schools with big names.
Yeah.
The likes of Opokuware, the likes of St. Louis, so many other schools that we managed to beat. And it sort of gave us some confidence that, I mean, we were very scared of some of the names that were participating in the Brilliant Science and Maths Quiz. So I must say that I got to where I am by the grace of God and by the intervention of an individual who probably saw something in me that I never saw in myself. Then from Navasco, I did my sixth form in Opokuware.
Oh.
So when I got to Opokuware, there were there was so much noise against me because they said, this was the same guy that beat them in the Brilliant Science and Maths Quiz. So why was I leaving the school that beat them and I was coming there for my sixth form? But I managed to sail through and then later on completed my MBCHB at KNUST. And then I pursued a specialized program in orthopedics and surgery in Makerere University. And then completed, and I've since been working as an orthopedic and trauma surgeon. But I've also been an administrator, combining that with orthopedic surgery from all levels of the healthcare. I started from the district level in Nandom, and then I went up to the regional level at the regional hospital in Upper West Region. And now I'm at the national, also regional level as a regional director in Greater Accra region. So I'm sure you probably have more questions, but in brief, this is Dr. Robert AMESIYA, my educational background, and then my family life.
Yeah. Wow. Very interesting one. A very interesting journey. Thank you for that insight. Let's go ahead to the next agenda we have. We want to know how you are combining family with your career, because here is the case: you are into clinical practice as an orthopedic and trauma surgeon, plus your administrative work, being a director of, you were a director of the Upper West Regional Hospital prior to this, and now you have been appointed, in fact, another bigger directorship position. So how are you combining this? How are you managing? How do you manage to get it done perfectly? We want to know.
Okay, so thank you, Dr. Sheila. Actually, even if you are doing nothing, you will still find something to do with your time. So planning and time management is one important thing. And for time, is something that doesn't wait for anyone.
Anyone.
So as an administrator and a clinician, what I used to do was to go early morning, carry out my administrative duties, then halt at a point, progress to my clinical duties. Then when I'm done with my clinical duties, I finish up with my administrative duties. And then, so what I had to leverage on were quite a number of things. One was delegation. There are quite a number of people in the space that are specialized in doing one thing or the other. But you ultimately bear the responsibility. So you delegate to the administrator, you delegate to the procurement manager, you delegate to the accountant, but you cross-check to be sure that the delegated duties were carried out as you wanted them to do. And then what you do is that you sample some of the duties you delegated to them and peruse them critically. And you do sampling without letting them know the pattern in which this sampling is done. So usually they are unable to predict and know what is the next thing you are going to peruse. So you find them ultimately buying into your vision because they get to know that this man can check this. So let's do it the way it has to be done.
Yeah.
The other thing was also to leverage on technology. We know these days we have a number of softwares that are available for us to be able to do monitoring.
Okay.
So if I want to know how many people come on time to the office, I install a biometric device that tells me the time people come, and it also tells me the time people leave.
Right.
But there is a tendency for people to come, go to their private places, and come later to log out. So you have to also introduce another tracking device with their softwares that is able to track them as they work. So you track them as they come in, you track them as they work, and you track them at the time they log out. So at the end of the month, you are able to tell who comes on time and lazes around and goes at the time he or she is supposed to go, or who comes on time and throughout the time is actually doing one thing or the other. And then you give people constant feedback. So people sometimes have genuine reasons why they don't show up at work on time, or why they come to work and they are unable to perform. So the systems are put in place not just for punishment, but also to counsel people and encourage them to put up their best. So when you give people feedback that we've realized that your average time of reporting to work is 2 hours after 8 a.m., then people are able to tell that, look, this thing that I've been doing, somebody is aware of it. You come to work, but throughout the time that you're at work, you don't do anything. And this is the evidence. So for instance, if you are a physician and we check that on a particular day, 50 people showed up at your consulting room and you are two physicians, but only one physician saw all the cases. The question will be, when you came, what did you do? If you go to the ward and then we're able to tell from the software that out of 30 patients, you saw only 2 and somebody saw 28. And then we give you feedback that, look, this is your output from the ward, this is your output from the outpatient department, or surgery. So people are able to know that, look, we get a genuine feedback from our output. And that in itself builds a culture of, self-awareness for people to know that virtually everything that you do, somebody is paying attention to it. And gradually you just realize that people are kept in line without you having to follow people with a cane like children to tell them, do this, don't do that, do this, don't do that.
Yeah.
So the other thing that we also do when I was also, at Upper West Regional Hospital, was to leverage on the existing governance structures. Because the Ghana Health Service has a structure in place that tells us that every week you should have a core management meeting. You need to do that and hear from the core managers. What are they picking on the grounds regarding their schedules? And then it also tells us that every month you should have your unit heads meeting and get a feedback from the unit heads. And that for every quarter, you should have a general staff there, and hear from the generality of the staff what they are happy with, what they are not happy with, what suggestions that they have. And you'll be surprised when you do that, how much information you can pick from your staff to help you deliver the kind of service that your community requires. And then what we're doing in addition was to do what we call community engagement, open day. You go to the marketplace, because if you ask people to come to the hospital, they may find one reason or the other. So you go to the lorry station, you go to the market square, and then you make sure that your staff do not handle that. You get somebody from a radio station or an independent person to find out what services that are provided in the hospital that are done in a manner that suits their purpose. What are the things that they dislike in the hospital space? And then when you get that, you implement it. And I remember in Upper West Regional Hospital, one of the open days, people complain that they come to the hospital outside visiting hours, they are not allowed into the space, but no space has been created for them to rest while they wait for visiting hours. So we quickly had to put up sheds around all over the place. And then places of convenience. People complained that unless you are in the ward, you cannot visit any place of convenience when you want to use. And we know these are natural causes. But if you don't give the community the space to give you feedback, and you don't give your staff the space to give you feedback, then you are unable to see how well or how bad you are performing.
Yeah.
And I think these are some of the things that we implemented that actually made our place attractive. And then we caught the attention of the headquarters that gave those awards one after the other. Thank you very much.
Yeah. Very interesting, honestly. So this open day is what has just caught my attention. How often did you do the open day? In a year or in a month? Engaging the community for feedback.
So in the year before the farming season, you do one. And after the farming season, you do the other. Because when you are doing it in the farming season, the typical farmers are in their farms. Only the other people are around. And then we know it is a very close community where people interact. So somebody may tell the other person, community member, that, look, these are the things that came out and I had to tell the hospital people my mind. And somebody will tell you that, look, but you didn't add this. So when the other one is organized, then you give that other person the opportunity to also. And what we did was that we never fought any feedback. Because the tendency is for you to think that because you are doing your best, everybody should praise you. But as you are doing your best, getting to the best is like moving around a circle. Somebody detects something that he or she doesn't appreciate. And you don't have to be discouraged or frustrated because that is the person's opinion.
Yes.
So you have one of two things to do, either to explain to the person or to restructure the system that will ensure that the person is satisfied. So that is what we're doing. And we encourage the staff that, look, don't fight. The fact that somebody says that when we come to a hospital, we delay before getting care is not equivalent to we don't appreciate what you do. But the person is telling you that among the millions of good things that you do, this is the one thing that I thought when you add it to the millions of things, I'll be totally happy. Yes. So you are very receptive to feedback. And then when people know, so for instance, when we had our earlier on open days and people saw that there are suggestions like putting up places of convenience, erecting sheds for them to rest before it is time for them to visit their relations, then people realize that, so if we give these people information, they will do something with it.
Yeah.
So subsequently, the open days that we organized had bigger crowds than we had previously, because people realize that whatever they tell us, we tried our best. Even though we can't say we did everything 100%, but there was an attempt to meet the community members, their needs based on the things that they complain about.
Yeah. Yeah.
Thank
Yeah.
you very much.
And I'm very sure they were very happy with you. I want to believe this is something you brought in. It wasn't there before you went. It
Yeah,
was
it's something that, we just had to, implement on our
uh,
own to
yeah.
interface with the community. Because
Mm.
before I went there, before the new hospital came up, there used to be an
Mhm.
old hospital.
Yes.
And there were these stories of, scuffles between community members and hospital, because the capital of Upper West, even though
Mm-hmm.
Upper West is largely a Christian region, but the
Mm-hmm.
capital is dominated by Muslim community.
Yes.
So the issues of dealing with dead bodies and others. So we
Mm-hmm.
just realized that probably the old hospital had issues because community engagement was not adequate.
Mm-hmm.
But if you tell people that, look, your relation has passed on, can you leave a deposit of this, which is refundable
Mm-hmm.
upon coming back to complete this kind of documentation?
Mm.
People just understand you. And once people know that, look, when they approach you on an issue, you do something about it. They just keep coming. And with
Yeah.
time, things just cool down. But
Yeah.
once you don't give them an opportunity to express themselves, then the only avenue left for them to express themselves is violence. Then you
Yeah.
hear that a community has attacked a hospital, and
Uh-huh.
then so on and so forth. So that
Yeah.
community engagement is a very good thing, and it affords you the opportunity to be accessible to the community members.
Yeah.
So even when you go there and you exchange numbers outside the open day engagements, when people have problems in between, they are able to reach out to you, and then you solve them, and
Yeah.
then there are no problems for you to deal with,
Yeah.
afterwards.
Yeah. Indeed. In fact, this is a very good approach because I mean we are there because of the people. As a health institution or health facilities, we are there because of the people. So there's no point we being there and the people are not satisfied with the services we are providing. So anything that will let the community members satisfied with our services, I think is what we have to look at, which you manage to do it very well. Thank you. So now that you are in Greater Accra as the acting Greater Accra Regional Health Director, are you still combining administrative work with your clinical work? Back at
I
Upper West, you were combining. Do you still combine here?
I'll say yes and no. No, because I'm still settling down.
Yes.
Accra is quite a big place, so it's good for you to know the cultural dynamics of the place.
Uh,
Visit virtually every nook and cranny of the place
mm-hmm.
to be well versed. But occasionally, when I'm called upon to assist in high profile cases like replacements of joints, I avail myself, but not routinely like I used to do. But I still do surgery, not as often as I do, but high profile surgeries. But what I'm doing more now is the administrative, to settle down, go around all the hospitals, go around all the health directories,
Yeah.
interact with the people, so that when problems are coming up, you can situate the problems within the context within which they come up. Because in Greater Accra, virtually everything that you can find in any part of the country, you can find it in Greater Accra.
Mm-hmm.
Rural, you have rural Greater Accra.
Yes.
Peri-urban, you have peri-urban Greater Accra. There
Mm-hmm.
are slums in Greater Accra. When you
Yes.
go to Collect Circle, there are people who don't know where to sleep. They are
Mm-hmm.
homeless. And
Yeah.
then when you go towards East Legon, Ajirigano, I mean, that is a very affluent place. So
Mm-hmm.
virtually everything that you can find in Ghana, you can find in Greater Accra.
Mm-hmm.
So it takes quite a bit of time for you to understand the dynamics.
Great.
And
Yeah.
then you look at the data. And Greater Accra is a very fluid, space.
Yeah.
In the morning, majority of the people move towards Accra, and then in the evening, they move back to their places.
Yeah.
So if you want to
Mm-hmm.
increase your coverage, you need to watch, have a discussion with your directors and watch if people are around East Legon with very high walls and you want to extend healthcare to them, what is the best way? Probably on Sunday, when they are leaving their homes to church, they open their doors, and then their dogs are in the doors, within their walls, and then you
Mm-hmm.
can talk with them. And
Mm.
then you may have to look at. So the dynamics in Accra is quite far-reaching, and it takes a bit of time to understand them. So now that is what I'm doing majorly. And then occasionally, when there is a high-profile case that I'm invited, I go to assist and then offer my expertise. So that is what I'm doing currently.
Wow, great. That's
Yeah.
excellent. Good to know. So now, I was told this is something I was told, and I wanted the opportunity to ask you. So I'll ask you here. This is the appropriate forum to ask. I was told that you sent your personal implant and some logistics to ensure that the Upper West Regional Hospital get into operation. And I was like, wow, if my classmates did this, that was very commendable. But what inspired that action? Because it was a selfless one to carry your personal logistics to say that we need to start this facility. This is what I have. I'm bringing it for us to start. What inspired that?
So quite a number of things inspired me. But one of the major things was, in fact, the way where I even got funding to specialize in trauma and orthopedics. Actually, there's this gentleman, Dr. Rompa from the Netherlands.
Okay.
He used to visit my former hospital, Nandom Hospital,
Right.
together with other hospitals across the country, Duayankwanta, St. John of God, St. Joseph in Georgia, to do outreach orthopedic surgeries.
Okay.
And for some reasons, he identified me as somebody he thought if he assisted to train, when he becomes old and cannot come, I can fit in squarely. For the reasons why he thought so, I'm sure he will be able to tell that better than I can do. So he single-handedly sponsored me. My sponsorship was not from the government of Ghana, like Get Fund sponsorship or other sponsorship that other people have. And it was quite a huge sponsorship. Sponsorship that included my school fees, accommodation, stipends, and I could come to Ghana twice a year by flight to visit my family, and extra money for recreation. So I was just wondering, somebody that was not a Ghanaian, if the person can do this. And he didn't stand to benefit anything.
No.
So whilst I was in school, I managed to buy a couple of sets. And I was just wondering if I had returned and I couldn't carry out any surgery, and the reasons were that there were no instrument sets, people will probably think that you went to do something else other than to specialize in orthopedics. So instead of accumulating the money to probably buy a very nice vehicle and return, yes, I invested them in the implants and then the sets. So I came to Nandom, started, and then when the new hospital came up, we were brought on board. Unfortunately, the people of Wa demonstrated and requested that the hospital had to be opened. And I'm not sure at the time whether the Ministry of Health was ready or was not ready. But in any way, they opened the hospital. Strangely, there was no seed capital. Strangely, there was no accounts for the hospital. So we had to do all that. Strangely, the hospital was not on NHIS accreditation and all that. And I just realized that if you say there is no seed capital, and anybody that comes to you, you have to send the person to the nearest place was Tamale. So I was just looking at it. So I just said, fine. We have to start in any way. And then we'll do what we can do. Because certainly there are things that are within the human control. And there are things that are outside our control. But those that are within your control, I think as a citizen of the country, you need to do what is within your control. And what was within my control was that these sets and implants became mine. But originally, the money that I used to purchase this thing was not from my savings, was from the benevolence of another person. So I just didn't see why I should shortchange people by denying them something that I can advance to them merely because that money became mine and I used it to buy. But without that individual support, I wouldn't have even been a specialist surgeon, let alone talk of having the expertise to do the surgery. So I think I owe gratitude to Dr. Paul Rompa, who single-handedly sponsored me. And I saw that, in fact, is good to sacrifice.
Yes.
And there are people that actually also are sacrificing their resources, sacrificing their time, even when they are not even citizens of our country. So if you are not a citizen and even from the north and they open a hospital for you, and I'm sure if that hospital had collapsed, when it started winning awards, people were happy. But I'm sure that if the reverse had happened, the blame would have also come to the leader that, oh, they gave you a new hospital to run, you couldn't run it, and then it collapsed. So we just had to do what we could do. And then it took us 11 months to get on board of the National Health Insurance. So I can imagine if we didn't start doing the things that we did, probably at a point in time would have had to fold up. But thank God, maybe I just thought that God brought me there at the right time.
Exactly.
And then also touch the heart of the right person, Dr. Paul Rompa, to sponsor me and give me extra money. And also touched me by not using the money for luxurious things like car, but for implants and then sets, so that eventually, I mean, who knew this situation was on the way? But it came, and because of the opportunities that were available at the time, we were able to surmount the situation. And then today, I think everybody is happy that that hospital, an ultra-modern hospital, has been maintained. All the state-of-the-art gadgets like CT scan, mammograph, and other things are still working. It is not the same situation in every part of the country.
No,
We have heard of stories of hospitals that cannot maintain mammogram, cannot maintain CT scans, cannot maintain fluoroscopy. But we happen to be able to do all that because, I mean, we took the cue from people that had the spirit of sacrifice, spirit of just do what you can do and give the rest to God. And I'm sure what we could do, people appreciated. And that is how come that the Ghana Health Service thought that, look, we deserve to be awarded because myself and then the staff who were there had done our best in running the place. So for 5 years, I mean, we've existed up to, and the last time I'm sure we won another award for Gilmis utilization, logistic management. I'm sure it's because we paid attention to what is within our control and just kept doing that. And what is not within our control, I mean, God Almighty will do it. And that is how we have survived up till now.
Wow. This is very inspiring. And with the experience of good leadership and the selfless nature you had and ready to sacrifice, all led to this. We are grateful. You know, that is my home region. So I was following. I have relatives there. So they kept on giving me good feedback. And I said, that gentleman is my mate. He's my mate. Thank you so much. Thank you for all the sacrifices and all that you did, your good leadership. Thank you. And we thank Dr. Paul. We thank Dr. Paul wherever he is for sponsoring you. God bless him. And God bless you too for not wasting that opportunity. You took good decisions at every step. You took good decisions at every step, and it came back to help people who needed it most. Thank you.
You're welcome.
Dr. AMESIYA, you have to tell us about the awards. What was it about? You had these 2 awards, 2023 and 2024. Your hospital, the Upper West Regional Hospital, was recognized as the best secondary level hospital in Ghana. That is big. The best secondary level hospital. For 2 years, 2023 you won, 2024 you won. This year you are not there, but I'm hoping with the good structures you'll win. What? I think you've alluded to how you did it, but then what was the award about?
So I think the Ghana Health Service has been on the drive of something the Ghana Health Service calls rebranding. The Ghana Health Service is the largest in terms of implementation of the Ministry of Health policies in Ghana.
Yeah.
So if you look at, but the image of the Ghana Health Service is not the best when you compare us to other agencies of the Ministry of Health. For instance, if you take CHAC, people think that the attitude of staff at CHAC hospitals are better than those of Ghana Health Service. But Ghana Health Service covers a wider area than any of the agencies of the Ministry of Health. So to rebrand, the Ghana Health Service took this initiative to institute these awards so that it will promote customer care. So at the staff level, people will be conscientized to offer their best to staff. And also at the leadership level, people will know that, look, if you are very innovative, if you adhere to the existing Ghana Health Service rules of managing facilities and you go beyond it to innovate to the benefit of the facility, you will be recognized. So it was on that score that, and then when you are running facilities, the Ministry of Health has some indicators that deal with maternal mortality ratio, indicators that deal with neonatal mortality rates, indicators that deal with your admission rates, also your revenue per capita, so many indicators that will show when they aggregate them, that will tell that, look, this is a well-run facility, or this is a facility that is collapsing. They also look at your financial health. If you look at your indebtedness and you add it to, you look at what health insurance owes you with what is in your bank, when they do a balance, is the balance positive, is it negative? So the hospital category was based on the indicators. So it is a standardized tool across the length and breadth of the country to compare you with other people, so that if your maternal mortality ratio is lower, if your other indicators are better, then when they look at the aggregates, they'll be able to tell that, look, this is number one and this is the last. So for those of us in management, they looked at how do you run the facility? Because when you are managing a facility, a certain result is required. And so there are deliverables that are the outputs of your managerial abilities. So those were the ones they did. So for me as an individual, I took the leadership for the 2 consecutive terms. And then for the 2 consecutive terms, a staff in my hospital had the most outstanding staff awards. One staff had it in 2023 and another staff had it in 2024. But incidentally, I had it in 2023 and also 2024. And then the hospital also had it, consecutively. So it is to ensure that we position Ghana Health Service to operate like private hospitals. We should operate the facilities like they are our personal properties, so that you don't treat patients as if they are not human beings. And you take your time to ensure that you explain things to the understanding of people. And your customer care should be top-notch, like what is done at the banks. You go there, somebody greets you, somebody does something wrong, the person politely apologizes to you, and then you ensure that you don't keep telling people to go out and buy things, but things that people need to use in the hospital are available. And then we don't have angels working in the hospital. So you put things in place for feedback, transparent boxes for people to write and complain, QR codes for people to scan and send their complaints, phone numbers of management members pasted all over for people to complain. And you make sure that when you address people's complaints, you individually get back to them and tell them that, look, this complaint you lodge about so and so, this is how we handled it. If you are satisfied, you thank us for handling it swiftly. If you are not satisfied, we can, scale it up. And then when you keep doing that, people talk a lot among themselves. But for this place, when you go and somebody misbehaves towards you and you report to the management, they don't take it easily. And you are able to solve problems there and then. And then people don't, escalate things to the courts and you save yourself a lot of trouble.
Yes.
It's very tedious, but it is very rewarding. But
Mm-hmm.
when you do it for a while, it becomes a routine, and you don't
Yes.
see it as an extra burden. Before you start it, you may see it as something that is going to be extra work. But as you start,
Mhm.
it becomes a routine, and then you are, able to do what is expected of you. Thank you.
That's very rewarding, honestly. And I think you deserve it because if you put all these measures in place, then you really deserve that award. I'm only praying and hoping that the people you train as you've left the region, they would continue the legacy you have left behind, and the hospital will continue striving forward and making the impact it did when you were there. I hope you keep checking with your people, those you've trained, to ensure that they are maintaining and even upscaling your legacy.
Yes, I do so.
Great, great. So, Doc, now that you are in Accra, you just mentioned earlier on that you've been doing familiarization tour. Yes, how is the experience like with your familiarization tour? Are you visiting district and municipal health directorates, or you are visiting health facilities? How is it like, and how is the experience?
So thank you very much, Dr. Sheila. The experience has been very, very, very great. I think the engagement, to use one word, has been very interesting. I visited facilities across board, private facilities
Okay.
that are key high outflow places, the quasi government facilities, military, police, and the rest are providing a lot of care to us.
Mm-hmm.
And then our own health directories, the teaching hospitals, our quaternary hospital, UGMC, is there.
Mm-hmm.
You need to understand the roles of everybody. And you
Mm-hmm.
need to also, they say there is no one side story that is full. So you need to hear from both sides. So the familiarization has been an eye opener. People tell you things that are not really what is on the ground. And when you get to the ground, you see it. Everybody has his perspective. But when you go to the ground, then you are able to see whose perspective is actually the situation on the ground. So I've actually finished with the familiarization. And I
Great.
can say it was quite educative because it offered me the opportunity to know the region very well. And then I went to places myself. So if they say this private facility is not cooperating, when you visit there, sometimes you are able to confirm they are not cooperating. Sometimes it is not the situation. It is the other way around, that they are
Mm-hmm.
even ready to cooperate, but our people are not forthcoming.
Mm-hmm.
So it has given me quite a good insight of the region. And that is helping me to settle down more faster than I actually expected.
Wow, 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 wow. Nice. So did you visit every facility and every directorate, or you had samples? How did you do it? Because
So,
Greater Accra is big. Did you visit
yes.
every health facility and every district or municipal health directorate? How did you do
So,
it?
so for the metro, municipal, and district health directories, I visited all. And I visited at
Okay,
least one or more facilities in each directorate, depending on their level.
right,
So, and there were even some that were smaller facilities, but from the handing over notes, I mean, things that were coming out of there wasn't the best. But I made sure that of the 29 districts, every district was visited, and in each
right.
district, facilities were visited. I mean, we sample facilities
Yes,
based on the roles they play. So if you go to, Tema West, you can't visit facilities and you leave the International Maritime Hospital because it's a state-of-the-art facility providing care to expatriates, and that is the face of Ghana in that part of the region.
right.
So you do a strategic familiarization. That doesn't have to do with only Ghana Health Service facilities. but to tell the others that, look, we are here to cooperate. We're not here to lord it over anybody, but to have a partnership that endures to the benefit of our population. So that is exactly what we did with my team. It was quite tedious because when I gave them the itinerary that I needed to do that less than a month,
Less
a
than a
number
month.
of them, a number of them told me it wasn't possible.
Uh-huh.
But we were able to do it less than a month.
Oh.
But people said I'll stretch them. But I said it's good to I'll stretch because we wanted to do it before the half-year review. Because you
Right.
can't review the performance of a region when you don't know the
Yeah.
region. So
Yeah.
we had to compress everything, and we could do 7 or more in a day,
Whoa.
sometimes finish around 12 midnight, just
Oh,
because we wanted to know the situation on the ground. So that when
okay.
you are
Yes.
reviewing what you know,
Yeah.
not that people are telling you stories that you can't even perceive. So as
True.
I said, if you mention any place in Greater Accra,
You
I
know.
have a mental picture of the place. It's
Yeah.
not that I'm going to ask somebody to give
Yeah.
me better and better particulars.
Yeah. Yeah.
Yeah.
Yeah. Yeah. Yeah. Doc, you mentioned 12 midnight. You want to say that close to midnight, you still had management meetings and all that at facilities?
Yes, so
Oh,
we made
wow.
people to understand that because usually and I met also all the municipal, metro, and district chief executives. For them, you can't meet them after some time. So I remember when we got to um, Pram Pram, Ningo Pram Pram, it was late in the
Yeah.
night. So we had to do a tour of the directorate, a tour of the polyclinic, slept over, and
Yeah.
met the municipal chief executive the next day. Because when there are troubles from the community, when you require resources to augment your services, those are the people you need to, partner with. So for
Yes.
them, you need to go and meet them at. But for our staff, we made them to understand that it wasn't that we wanted to overstretch them or punish them. Because me, myself, I could go several days without rest. And it was
Please.
not that I don't know how
Uh-huh.
good rest is, but we
Yes.
wanted to get things in perspective before our half-year review.
Yeah.
So
Yeah.
I'm happy they cooperated, they understood, and then we were able to do that. And when we had a review, anywhere they mentioned the manner in which I spoke about it, they were happy. People were, surprised that within this short time, I'm able to familiarize and know where this health center is, where this chief compound is, and where this facility is. And I think that has helped me a lot to settle down.
Yes, yes, yes. You see, and that comes with a lot of sacrifice and dedication again. Well done,
Yeah.
my mate. You see how I'm laughing? I'm a proud mate.
Thank
Thank
you
you
very
for
much.
that.
Uh,
For that. So yes, we've seen that you've been fostering a lot of collaboration between the Greater Accra Regional Health Directorate and some partners. Recently, we realized that you visited the Korea Foundation for International Healthcare. What is that collaboration about? What is that partnership about? Can you throw a little bit light on that?
okay, so for partners, we can't do without them, even though they have their interests, but you ensure that you help channel their interests to that of what will inure to the benefit of the Ghana Health Service. So we are we are doing a partnership with KOFI, Korean Foundation for International Health, to put up a biomedical engineering unit. With the experience from Upper West region and knowing that medical equipment have their lifespan, just like human beings have. I mean, if you give birth to somebody and the person dies within a year, that is a premature death. If somebody lives up to 90, 100 years, that is celebration of life.
Yeah.
It's the same thing for equipment.
Mm.
What usually happens is that government procures equipment. In no time, the equipment are broken down, and then we're back to square one.
Mm.
So they are supporting us to put up a biomedical engineering unit with the state-of-art repair setups
Wow.
that can help us go around and fix back dysfunctional biomedical equipment so that we don't dispose them of when their lifespan is not up. And that routinely we can maintain, service, and repair them so that people don't have to be moving up and down looking for one service or the other. So that is the partnership that we have had with the Kofi. And the building is far advanced. They started it in less than a few months. It's almost complete. And when it is completed and refurbished, we know that services of our biomedical equipment will be enhanced, their lifespan will be prolonged, and then services to our people will be better than it has been. Because you want to do anything, you have to go to the private sector. We are not fighting private investment, but we think human beings should have a choice. I should choose between going to Kolubu to going to UGMC. I shouldn't be forced to go to a private place for an investigation just because it is not available in the public space. But in the public space, time and again, government tries its best within the constraints of budgets to provide us equipment like MRI, CT scans, mammograms, and fluoroscopy, and then the likes. But in no time, these things are down because we don't have a system in place to ensure that they are routinely serviced. We don't have systems in place that can ensure that even a part is dysfunctional, this is how you replace it so that it can be prolonged. Because even in the private sector, people buy refurbished gadgets and they are able to operate them. And then when the government of Ghana buys us new gadgets, we are unable to operationalize them. It is a paradox. So I think that is to do. And we think that is a laudable initiative. Then it is complete. It will largely help us to prolong the lifespan of our biomedical equipment and invariably improve the quality of services in the Greater Accra region.
Yeah, indeed. This is a good cause. But then, is this the first of its kind? Is this the first of its kind? Do we have such an establishment already in Ghana, or we don't have any organization servicing the public sector biometric equipment? We don't have any.
So Kofi has done a similar one in the Volta region.
Okay.
But we also have individual vendors within the country. You have Siemens, you have Philips. All the equipment that we have, they have their offices or establishments in the country.
Right.
The issue has to do with the cost.
Yeah.
If you have to service an X-ray machine or repair an X-ray machine, which is a Philips machine, the cost that you require is sometimes quite demanding. So I think those are the things that is hampering some of the facilities to be able to maintain. And that is what we are thinking, that some of the servicing doesn't require the parent companies to do.
Yeah.
And then that is where we fit in. So if you are a biomedical engineer of the Ghana Health Service and you come to utilize the center to repair something of a facility, then the cost will not be so high that the facility cannot bear. But we have every equipment that is supplied. They have satellite offices in the country that are servicing.
Right.
It's just that the cost is high. You know, health is a social service. So you cannot charge as much as the output because people across the board access the service. Poor people access the service, the middle class do, and then the rich also do. But the service has to be said that it is not out of reach of the average Ghanaian.
Exactly.
And I think that is what this will come to help us do.
Exactly. Wow, nice. I'm hoping that after establishing this in Greater Accra, they will establish one for the northern sector, because they have one in Volta region. We are having this happening in Greater Accra. When they establish one at the northern sector for the health facilities up there, so that they can also benefit. Thank you for that. Firstly, I have no doubt that you are going to do well, Doc. I have no doubt that you're going to move the Greater Accra Regional Health Directorate to another higher level, considering what you've done at Upper West Regional Hospital. You are going to do good for us in this region. Thank you for that, and congratulations in advance.
Thank you very much. Thank you very much. And I
Yes, Doc.
appreciate it so much for you saying, I've been following you and I see how your space is followed by several people and the good works that you are doing. So
Thank
it's a privilege for me to also have an opportunity to take a bite
you.
of the
Thank you.
good things that you are doing.
Thank you. You
Yeah.
know, the little we can do in our own space, as you rightly said, we do. So wherever we all find ourselves, the little we can do to improve our society, improve on the lives around us, we have to keep doing. Yes, Doc. So, Doc, we have come to the end of this discussion. But since this is for the youth, I don't allow my guests to go without them giving us some words of wisdom, some motivational message or inspiring message to our young ones. So kindly do that for us. You are a great inspiration.
All right. Thank you so much for those kind words. So, for the youth, what I will plead with that, number one, what is a threat to the youth these days is these illicit drugs, which I encourage every one of them to stay away from. But the other one is that for career growth, you just need to focus your attention on acquiring skills in your area, whether you are in architecture, you are a carpenter, you are a doctor, you are a nurse. Your first focus should not be how much do I get from this. The first focus is what skills can I build from this career that I've chosen. When you acquire the requisite skills, you'll be surprised what comes to you. The other thing is don't be in a hurry. What many people have, probably they got it from inheritance and they got it out of some goodwill. But so you shouldn't compare yourself to the next person. In fact, the person you should compare yourself to is yourself, today and yesterday. If you are better today than yesterday, it means life is progressive for you, which you should be very, very happy with. The other thing is not to cut corners. If you want to cut corners, you may have to embezzle. If you want to cut corners, you may not do things to completion and you'll be exposed. And life is increasingly becoming complex because social media has made the whole world a small space. So if you think you can do something and go into hiding, you are deceiving yourself. In the past, that was possible. Currently, that is not possible. So what I will advise the youth is, whichever area you choose, you can succeed in as far as you pursue maximizing skill sets in that area. And then once you get adequate skills in your chosen area, the rest is that, in fact, the best advert is the human beings that you get into contact with will tell other human beings what you are made of. And then it is far, far, far better than radio or TV adverts. Human adverts are testimonies that people give on their own. So I encourage the youth not to be frustrated. We know it's very difficult these days to come by jobs, but we know people that have jobs that they are not really cherishing because they think they could have gotten other better paying jobs. So they are not happy in their current jobs because they think the salaries are not good enough. So they don't do it well. And because they don't do it well, they don't get, that approvals for them to be able to step on to other rewarding jobs. So
Exactly.
you just virtually become your own enemy. But whatever you are doing, if you do it well, people will recommend you for higher, responsibilities. So I just encourage the youth that, look, stay away from drugs, focus on your skill sets, and then when your time is due, your success will come and nobody can, block it. Thank you very much.
This is priceless, honestly. And this is in the spirit of patriotism, selflessness, and resilience, which you have demonstrated undoubtedly. So, my youth, I'm sure they have listened, and we will all ensure that we do things right. Do what we are doing and do it right so that we can get a recommendation for higher position. Thank you, Dr. AMESIYA. Thank you for spending time with us this afternoon. Right. Viewers, we have come to the end of today's episode of Youth Empowerment Series. I believe we've all been blessed by this good discussion. Kindly share this video with all your contacts. Subscribe to the channel if you've not yet subscribed, and turn on your notification bell so that when we post another video, you will be notified to check on it. Thank you for sticking and staying with us. See you soon. Bye.